Hi everyone, this video will explain to you the tray setup for a well woman exam. So for female adults, they need to get a physical exam once a year, and it includes the breast exam, pap smear, and Hemocold. I have here the tray of supplies that you need to set up for your provider. So we need lubricating gel, right? So this would go on the end of the vaginal speculum for ease of insertion. And then the speculum, you want to make sure that you put down the light source on the Mayo stand as well so that the provider can illuminate the inside of the patient's body for better viewing. Some gloves down, the 3 different types of brushes, and these are really important because this one you can use to clear discharge that's in the vagina to better see the cervix. And then these 2 are really important. These are used to scrape cervical cells off of the end of the cervix. And then once the provider gets a sample, he would hand you the brush, right? And you would take it and insert it in here, the thin prep bottle, and swirl the brush to get the cells into the bottle. And then this is what you send to the lab with the patient's name, date of birth, your initials, and the date. And after they've done the pap smear, so the order in which they do the exam, so they'll do the breast exam first, pap smear, and then the Hemocold. So here we have the Hemocold card and the developer. So for the Hemocold card, the doctor, they will get a sample of stool on their finger and wipe both of these windows on the card, and then you would reverse it over, open it up, and put down a drop here, here, and on the control. If there's any blue on the card, then the test is positive for blood in the stool, and if that's the case, the provider might order a colonoscopy or a Cologuard for the patient to rule out colorectal cancer. Okay, so this is the tray, and besides the tray, we also have here the table that you need to set up, right? So you got to pull out the stirrups so that we can get the patient into the lithotomy position. We need to have a chest gown for the female patient so that she can be kind of clothed prior to getting the breast exam done. And then there's like a drape that she would put on the lower half of her body just to give her some warmth before the procedure. And then we have also just a chuck put down so that there's more of a barrier between her and the exam table. And we have over here, so sometimes female patients that come in and they have symptoms of an STD. So if that's the case, and even if they don't have symptoms for young females, we routinely just screen them for gonorrhea and chlamydia just to make sure they don't have it. So it's most commonly screened by getting their urine, and we can test their urine. So here's just a urine cup for that. And if a woman maybe she has symptoms of herpes, so here's the test for herpes, and you can also do it as a blood test as well. This one would be to swab the lesions if lesions were present. And then sometimes too, like women have symptoms of an STD, so if they have discharge, and the provider thinks that they have gonorrhea or chlamydia, we would use this to collect a sample of the discharge to send to the lab for testing. So it's a good idea just to have these off to the side, just in case the provider needs to do these tests as well. And there's even, I just realized there's a test for bacterial vaginosis. So I wanted to show you guys that. And I don't seem to see it in here, but that's okay. So you would have that kit as well out out on the table. And you also want to, for the woman, have some napkins and a toilet out for her to cleanse herself after the procedure. So that, in a nutshell, is how you would do the setup for a well woman exam. Thanks. Bye.